So again, thanks so much for tuning in. My name is Eric Elliott, and I'm pumped about this webinar. I'm the Advanced Hunter Education Coordinator with the California Department of Fish and Wildlife. And let's introduce our topic and presenter tonight. The longer you spend in the wilderness, the more likely you're going to experience some type of wilderness emergency. In my game warden career, the radio comes on and it never ceases to amaze me what kind of calls come in. There's all types of emergency responses. I've had everything from a backcountry skier breaking a bone in the middle 2 or 3 miles in, and calls coming in about a panic attack because somebody's gotten lost and it's getting dark. And sometimes the response that we provide is an A+, and there's other times where there's areas of improvement that is needed. So what helps us to improve? Sometimes after an emergency response or even like a high-risk search warrant, we have what's called a debriefing. So after the event, the first responders get together and say what worked well, and then what could be improved upon. So tonight is kind of going to be like a debrief where we talk about some of the most common mistakes which are made during a wilderness emergency. I'm thankful to have a friend with me tonight and a certified hunter education instructor. Rick Travis is with us. Rick currently works for the California Rifle and Pistol Association. He's taught basic, intermediate, and advanced wilderness medicine and instructed wilderness EMT courses. He's worked in wilderness medicine for over 20 years. Rick, thank you so much for being here. The floor is yours. Kind of give us a little bit more background, if you don't mind, and start us off with the webinar.
Yeah, so I have done this started off doing this just prior to the military, working for a police department here in California, learning search and rescue techniques and some basic medicine at that point, and then went to the Air Force and worked in rescue operations there. Came out of that and have been an EMT, paramedic, have been parts of search and rescue teams, and have pretty much just about every environment short of the South Pole and North Pole worked in this space, and have been an EMS director before I retired from working in emergency medicine. So I've seen this from all angles. I've seen it from that of the rescuer. I've seen that from the, as you said, debriefing a group of people. And so I'm not the kind of guy who's going to tell you a bunch of stories, because all those things and $6-7 gets you the same thing at Starbucks that gets everybody else. But I am going to use some of those to highlight why these are mistakes, how they happen, and how to try to avoid them. My wife loves to quote this quote that, a smart person learns from their mistakes, a wise person learns from other people's mistakes. And so tonight I'm hoping to help a lot of you be very wise by learning from other people's mistakes. So with no further ado, I will give you guys a little bit of a roadmap, and then we'll get into it. So a second. Let me see if it works better on this side. There we go. So sorry, I went a little too fast. So we're going to look at common mistakes that are made in the wilderness as they apply to when you first arrive on a scene, looking at the assessment of a patient, trying to figure out your diagnosis, looking at your kit, what you brought with you. We'll talk a little bit about wound care and why that's important. We're going to look at some environmental issues, some issues around hydration, nutrition, often the lack of proper training, and then I'll introduce you to a couple of resources, and we'll do the Q&A, and hopefully everybody will take some stuff out of this. So wilderness medicine is very interesting to me because a lot of people don't realize it's very closely related. So the first definition of wilderness medicine is a medical specialty concerned with medical care in remote wilderness and expedition environments. This specialty includes prior planning, which rarely happens with a lot of teams, public health issues, a number of subspecialties, as well as responding to emergencies. That's from Wikipedia. Wilderness medicine according to the National EMT, is characterized by remote and improvised care of patients with routine or exotic illnesses or trauma, limited resources and manpower, and delayed evacuation to definitive care. So think of this as, I was talking to Lieutenant Elliott earlier, this type of medicine is the unexpected, the unexplained, under the worst circumstances, with the worst resources, and everybody expects you to have a really positive outcome. And so if you're not thinking in that term and you don't have your head prior to going out into the wild, you're going to be in trouble. So a lot of people ask me, well, Rick, I only go to the wilderness maybe a weekend or a week of my entire year. So how do I do that? Well, folks, if you've ever been in construction, you realize what separates you in your home from nature is very thin. You know, it's a couple of 2x4s and a couple of ½ inches of, drywall, maybe a little bit of plaster. It's not much. And when natural disasters, or worse yet, man-made disasters happen, you will quickly find yourself in a wilderness situation with very few resources. So if you prepare at home for natural disasters, you're already taking one of the most basic steps to prepare for wilderness medicine. And if you're thinking those terms, you're going to probably fare a lot better than people that haven't. The next thing I get asked most of the time is, well, what about certification? So I really want to bring this up. There are lots of different options, but it should never be viewed as scary. There's wilderness first aid, which is different from your regular first aid with the Red Cross. There's a first responder, which you're a bit more adept at what you're doing. I highly recommend that for most instructors and people that are going to lead a couple of people out there. Then there's wilderness EMT, which is an addition to a regular standard EMT. There's advanced wilderness expedition provider. That is something that you would go through about a 2-week class to hone your skills, but that's if you were doing an expedition to some part of the country. And then there's the search and rescue wilderness responder, which has more of what we call a SAR, or a search and rescue aspect to that. And then for ER, being emergency room physicians, they can also add a wilderness thing. And those are the physicians, in my mind, that are at the top of the level. But what I want to explain to everybody, there are Boy Scouts that actually have, and girls now in scouting, that have wilderness first aid training that far exceeds the average person going to the woods. So don't look at the age of the person and think, oh, well, they're not a wilderness physician, so they can't help me. They can, but also that means that all those materials are out there for you to take advantage of. So for those of you who work in scouting, don't look at that as like yet another patch. I worked in scouting for 25 years, so I get that attitude. Don't have that attitude when it comes to this. But also, we have, since the pandemic, opened up many, many routes for you to be able to do a lot of this online training, and then I'll put some additional resources at the end. So not having the education there's just not really an excuse for it anymore. Next, are common mistakes made in the wilderness. So we're going to talk about that for a moment. This is one of my favorite wilderness pictures. It's one of my friend's Goldens from a long time ago out in the woods. It's idyllic. It's what, especially as hunters, we want to see it, especially as people go into nature. We want to see it. It's just that pristine moment. And that is, in my mind, where Mother Nature can really hang you up when it comes to wilderness medicine, because you can get very relaxed, very distracted very quickly, and miss a lot of things. And every after action report I've ever worked on, every scene I ever evaluated, I did medicine in Sequoia and Kings Canyon here in California during summers. I can tell you every review always started off with a couple of items we'll talk about today, but one of them was just being distracted, not having your head in the game. And so as we go through each of these mistakes, think back to this picture and realize where people probably started to make those mistakes. So, the first thing generally is rarely are you going to watch the incident that leads to the emergency unfold in front of you. It happens, but most of the time it's somebody in the party or somebody you walk upon something. And so Here is what you have to realize. You have a lot of protections, but you need to be able to tell people what happened. And just like, the game wardens that are on here will tell you, there is an adage, if you don't write it down, it never happened.
Mm.
You do not get to go later on when somebody says, well, what happened? And look up at the sky and try to come up with what happened. You got to write it down. I always share this, my notorious way of handling this, and it worked for years until I retired, and then I kept writing on my pants, but I would take the medic tape and rip off a couple of pieces and put on my pants and write on that. And it started off with this very next slide called arriving on scene. So the first thing is I've got a rattlesnake up there, and people say, why? It's scene safety. You do not know what caused the incident. And, wardens will tell you stories of people being caught off guard by all sorts of issues. Park rangers will tell you. I will tell you from a rescue person, when you're out there as the first responder, one of the most tragic things I saw early in my career in New Mexico was a family where 3 people had been bitten by the same snake.
Wow.
And what had happened was the child had got bit, the child's holding their arm, they're on the ground, dad rushes in to get around the child to figure out what's going on with the arm. And as he bends and opens up his arm way high up, the snake bites him under the arm.
Oh, man.
Because he doesn't even see it. So what does the mom see from her standpoint? Because she never moved, she wasn't watching. She sees her husband almost collapse on her son. So she runs around to try to push her husband to the other side of the son and gets bit in the ankle. Now we have
Wow.
3 victims. The snake had a chunk of venom, so the old adage that it got lighter and lighter, that wasn't true. And I was actually in the military, and we got called out to do the medevac on it. And it was like this chain of events. And there was a 4th person that almost got bit, but then they heard the snake and they backed off. The first 2 didn't even hear the snake because they just get into an auditory response where you're just not hearing everything. So
So
I
you're
tell
talking
people,
you're talking about like tunnel vision, right? You
right,
just get so locked in on the actual patient that you forget to check the rest of the scene.
right. And so this is why I say you need to, A, make sure the scene's safe for you. And if it's not, don't go into it. But take a full stock of the situation. Try to figure out like what happened before you go to talk to people. And then that's why I have that bottom thing, taking notes of your first impressions, your impressions, not what anybody else is feeding you. And so you put on AOS, I arrived on scene, I put it 13:24, which would be 1:24 in the afternoon, to find, and then what you saw. That's your opening line, because that frames everything that will follow. I have seen over and over people forget to do this. And then, 6, 9, 12 months later, somebody wants to know. Sometimes it's in a courtroom. Sometimes it's, the medical authorities want to know information. Whoever the responding agency was, whether it's fishing wildlife, or it's, forest rangers or BLM, they're going to want to know stuff. You got to have this, because without it, you're going to be in trouble. All right, next one. I'm giving you a couple of things that EMTs and paramedics use. I've lived by this stuff, and I'm going to talk a little bit about them. So the first one is called SAMPLE. This is a great acronym. You need to learn it. You need to write it down. But it starts off with signs and symptoms. And I want you to realize it's like, what do you see? And then what is their chief complaint? Those, in the vast majority of incidents, aren't the same thing. You're going to see something different. But what happens is you get locked in on what the patient's telling you. And in a few slides, I'll tell you why that can be really bad when that happens. So you want to mark down, what are you seeing? Secondly is you want to find if they have allergies. Do they have allergies to insects, food, pollen, fabrics? Because a lot of times that will tell you. I've known people that are very allergic to the wild mustard that we have here in California. Well, all of a sudden the person says, I'm short of breath, and they fell down. You look and they just cut through a field full of wild mustard, and then they tell you they're allergic to it. That starts to put maybe part of the story together. The next one is meds. And I gave you an acronym called SHOP. So there's street meds. Maybe they're taking something off of the street that they shouldn't be taking, or maybe it's legal to take it, but it's influenced their behavior. herbal medicine, that can tell you a lot. If somebody says, yeah, I use a lot of different holistic, medicines and oils and stuff, that could alert you that they have a pre-existing condition. Over-the-counter meds that they've taken, if someone's taken because they're afraid of having an allergy attack and they took any antihistamine, that can cause them to not be at 100%. That may have led to the issues. And then whatever prescriptions they're on. If they tell you they have prescriptions, that's also going to tell you about some of their previous medical history and also allow you to know, like, oh, well, they're on heart meds. We're at altitude. That could be a part of the play. Past medical history. This is key. Find out if they have a pre-existing condition or occurrence. Because if there's like, no, I haven't had one of those. In the next slide, you're going to find out why that's so important. Find out when the last oral intake is. And I put nausea or vomiting, but a classic thing, I had it up on the 10-mile road in Sequoia. People were drinking a lot of water, but they were passing out. And I was like trying to figure out, like, nobody else is passing out. What's going on? Their last oral, this is 3 o'clock in the afternoon, by the way. Their last oral intake was dinner the night before. They were so excited to get up and go see the sunrise. And then somebody in their group said, let's see if we can do this 10-mile road hike. And they started on, they had no food and they hadn't eaten. Bet you low blood sugar was one of the causes of why they were fainting. Yeah, they just didn't have the energy. And so that can be an issue. And that will come into play a little bit later, because one of the problems was nobody in their party and nobody in adjacent parties had any food beyond what they had had for the day. And that can make, secondary and tertiary issues very quickly. And then the events, ask them what they were doing leading up to the event. This may be where they said, oh, we were sitting around the campfire, we were drinking, we were doing this, or, oh, we were doing that, or, oh, we played football at altitude, all sorts of things that can kind of give you a feel for what may have led to the actual issue that you're seeing in front of you. The next one, this is called DCAP BTLS. It's a weird acronym, I know, but here's where issues happen. So you're looking and the person tells you, saying this scenario, that their shoulder is really messed up and hurt. Well, if you focus on the shoulder injury right up front, you may miss other things, and most often will. So you've got to get under the clothing and you got to start looking for other deformities or discoloration. So, you start seeing bruising. Well, remember when we went back and I said under sample, you're asking what's happened in the past. Is there anything pre-existing? What they say, no, you go, so did you ever have a bruise right here? No. Oh, and they have a really fresh new bruise, then there may be other injuries. But if they say, oh yeah, that's when I fell yesterday getting ready for the trip. Oh, what about this one on your leg? Oh, I got that 2 days ago when I fell. Well, now there's a pre-existing condition. They may be one of those people that just don't go to the doctors, don't get things checked out, but now you have that information. That is critical, because later on, a lot of times you don't have the information. Just saying, I've got a person injured in the woods, come help, doesn't help the people to know what resources, what they're going to face. The more you can give them, the more the puzzle that can be solved and the better the outcome. And I'll give the example. We had a group of people that were down in Anza, Borrego Desert area, and they were in a little valley. And I happened to be in the area, but also a nurse was in the area. And so the people that were with the nurse thought the nurse was like the senior medical person. That's fine. And the nurse looked at this person and said, oh, I think you're just a little dehydrated. I walked in, and just because in my career, I'm sure the wardens will tell you this, there are some wardens who just get the dark cloud and they get to see all the same kind of stuff and they get really good at it. I dealt mostly of my career, I dealt with major fractures at accident scenes and dealt with emergency cardiac issues. And so the minute I looked at him, I realized we had a major cardiac issue. He had aneurysm that was about to blow. And I got a medevac. Had he stayed under the nurse's care, and had I not done this and looked and saw some telltale signs, he wouldn't have made it, because they medevaced him to Palomar straight into the OR based on the information I gave the helicopter crew. And while they were in surgery, things started to go south and they were able to save him. But without that, he doesn't get saved.
Right.
And to be fair, there's a couple times where it didn't work out that good when I was working on people. So I just want you to realize you need to go down, you need to look for contusions, abrasions, punctures, penetrations. Not every puncture or penetration is going to bleed really bad, so you may not see it. You got to go looking for it. Burns. I've had people that, conked their head, so everybody's looking at their head. Why they conked their head? Well, their foot literally had second-degree burns on it because they stepped in the coals of the fire, and nobody saw that. And nobody treated that. In 2 days into trying to get them out, because they're about 30 miles inland, we had major wound care issues. Tenderness, lacerations, and swelling. And so these are all things you want to be able to do. And so this is very simple, that you can write this on the inside of a book, inside your first aid kit or wherever, just so you can go through it. And head to toe, start at the top of the head and work your way all the way to the toes on both sides of the body, front and back, looking for these things. Okay. Next is communication. This is probably one of my most biggest pet peeves in rescue and wilderness medicine work is, and I shared with Lieutenant Elliott earlier today, I have come upon people who have been in really horrible situations. They had very expensive satellite phones that they had taken out of the box, but never turned on and never had a subscription for. And trying to figure that out in the field during an emergency is no bueno. It's just not where you want to be. Secondly, I've had people go out with ham radios. They take a class a couple of weeks before going in the field, and they don't realize that what they tuned it into their home is most likely not going to work, because ham radio relies on different repeaters and stations. And if you don't know the ones in the area you're going, that is going to complicate things. Radios and walkie-talkies, again, same kinds of issues. I shared, it's not funny, but I had a lady who literally looked at me and said, I don't understand why my cell phone doesn't work. And I'm looking at her because she's literally out in the middle of nowhere in a pine area. And she goes, because all the pine trees in my neighborhood, the cells, they work with the cell phone. And I'm like, those are fake pine trees. These are real pine trees. There were reasons for that, because she also had some medical issues that no one knew until that point. But I'm just saying, like, you got to make sure that you have a communication plan before going into the field. And this is what I mean by communication plan, not only what you have for communication, but a plan. If it was Lieutenant Gregory and Lieutenant Elliott and I and a couple other people going in the field, we would have a plan. Who was going to be the person that led the communication? Who's going to be the person that leads in the medicine? Who's the backup? Because I have literally showed up 2 hours into a medical emergency, and the people surrounding the person are still arguing and fighting. And you can't have that, because it has cost people limbs and lives. And you just don't want to live with that. So have a plan, have it well thought out before you go in, because that's a common mistake that is made. Misdiagnosis. So I promised you earlier the story. So we recreated this picture, but as you can see, the patient has a shoulder problem. So in the real life, the patient had separated his shoulder. It was out of the socket, and he was complaining about it. And he was sitting on top of his jacket under a tree. The tree was actually a little bit bigger than this one. And so shoulder's dislocated, and the focus is, well, that's the chief complaint, so go handle it, right? So they get the shoulder in a sling to get everything ready, and they said, hey, we got to get you off here. And they stood him up, and he died. And the reason was, what had caused the shoulder to dislocate was in the fall. And during the fall, even though he was only 25, he hit his hip just the right way on the rocks and had fractured it and had put a cut into his femoral artery. But when he was sitting down, the body and the angle had put pressure on that artery. They never looked for anything else. And when he stood up, he bled out, basically.
Wow.
So, and EMTs get taught this all the time. Don't have someone stand till you checked everything out, look for stuff. So this is one of the things, I'm not going to go into everything in this class, but this is the reasoning why you can't let the chief complaint unless it's a major bleed. Yeah, if it's an arterial bleed, they can't breathe, of course, go handle that first. But if it's like, my arm's broken, okay, I know that hurts, we'll get to it, but you want to go check all the other things first to make sure that is the #1 priority.
Good wisdom.
Next is improper kit. So this is an area where a lot of people want to buy one first aid kit. And so they might get something like this, your individual first aid kit, or they might go buy a really big kit and say, hey, I've got my first aid kit. Both of those kits are for different things.
Mm.
Um, if you're taking a group of people bike riding on a century bike ride, you want to get a cycling first aid kit because it has different things in that are specific to injuries you're going to find in cycling that you're not going to have in the kit that you take in the back of your car for everyday use. It's not going to be the same as the kit that's designed for a hunt. One of the things I like that Adventure Medical does, but it's not exclusive to them. But if you look on the red one, you'll see it has four people, it'll say like 2 to 3 days. Well, that's a kit that's good for up to 4 people for 2 to 3 days. The second thing is know your kit before you go. I cannot tell you how many times I've seen somebody trying to break the zipper for the first time on the scene. And then you're rifling through looking for stuff, you're losing things are going everywhere because you're panicking, because the patient's like, holy cow, you don't know what you're doing. you need to know what's in your kit and organize it so it makes sense to you. If you don't like where the band-aids are, move them around. You don't have to live by it. It's just a kit that holds your stuff. Make sure, like I said, rule 3 is the proper size for the group. Do not chintz and go, oh, well, shoot, we decided to add 3 people, but our kit's only for 5. Now we have 8. Go get another kit. Which brings me to rule 4. Murphy's Law isn't funny because it's real. I always told the medics that work for me the same thing. Redundancy is your best friend. So, I'm a big believer. Everybody should have their own first aid kit. And in a group, you should have at least 2, if not 3 or more kits. And the reason is, I know Lieutenant Gregory well enough. I can say this. Lieutenant Gregory lays her pack down. Something bad happens and the pack gets kicked and goes off the side. If you have one medical kit, I guarantee you it was in her backpack. And now we're all like, wow, that's a long drop. Who's got a rappelling rope to go get that? Because that's where you're at. So always have extra kits because then you're going to be fine. The other big mistake is this is the #1 thing I have found, especially in search and rescue operations, that people took out of their backpack to lighten their load.
Wow.
They take out their first aid kit and their extra food and their extra clothing. And I'm like, 2 of those are not real smart to start off with. So, don't have an improper kit. And don't be afraid. Here's the other thing. I get it. Some of these kits are a little bit pricey. But as somebody that had a major injury, ended up in the hospital, almost didn't make it, which was me, you feel really stupid when you're like, wow, had I spent $1,000, I wouldn't be here. When you get out of the hospital and you see the bill and what you put your family through, all of a sudden, like $1,000 is like 10 cents. Yeah, so a lot of these kits are like $50 to $100, $50 to $100 for peace of mind and to save a life is great. And a lot of people ask me, well, Rick, I see my kit's about to expire. What do I do? Donate it to a youth group that is doing first aid, like a Boy Scout troop or something, right off in your taxes, get a new one. It's like a win-win. Okay. Next, wound care. So wound care is a big issue. And here's why. A lot of times bad things get worse in the wilderness. Any of us that have hiked any times in the Sierras can tell you, you can have a weather forecast that says it's going to be clear for 3 or 4 days. It's been a beautiful day. And all of a sudden the clouds come in and you've got a storm. And maybe that storm prevents you from being able to move safely down the mountain because you got a person that is not ambulatory like they were prior to the injury. Now you have wounds that you might have thought in the back of your head, well, they're going to be in like the next 6 hours in really good health care. Now it could be 12, 18 or more hours. So first things first, make sure you clean it properly, keep it clean. If you have triple antibiotic ointment, which they should in most first aid kits, use it. But if delayed, maintain the wound care. And a lot of people are like, wow, I never learned that in first aid, Rick. Yeah, because it's basic first aid. This is why taking advanced medical training is so critical. Where I work, we teach classes on this, and it's absolutely important that you work with people and help them to learn. Anybody that works in a hospital will tell you wound care is one of the biggest areas where people's health goes south the fastest. So you got to realize on your body, you have billions and billions of bacteria and fungus that are good for you, but also you have ones that aren't good for you. And when you open up the skin, which is the largest organ on the body that protects everything else, they invade, and they invade quickly. So wound care mistakes have taken what was relatively a minor wilderness injury and made them very critical, and sometimes in less than 24 hours. So one of the biggest things I tell people to understand in wound care is temperatures. So I'll use me as the guinea pig. I normally run a normal everyday temperature for me is about a 97.2. I run cool compared to the national average. So if I'm at 98.9, Lieutenant Elliott's probably like, well, shoot, he doesn't have a temperature. But him at 98.6 and 99.9, Lieutenant Gregory would be like, you're running a fever. So was I. So that's what part of the reason, going back to that patient history, you want to know things like that. Because if all of a sudden I start getting into 99, I'm actually breaking the 100 mark for the average, which means, well, if I'm not sniffling, I don't have a cold, I probably have an infection, and that's probably at the wound. And so you want to go check that out, and that becomes another reason to get that person to advance medical care quicker, if possible. So environmental issues. This is one of the areas that I love to teach on because it's so easy to make this mistake. Person gets hurt, and that's why we recreated this, as you can see in this picture, but person gets hurt out in a meadow. But along the edges of the meadows, we all know, often you have like tree cover like this, pines, oaks, manzanitas, what have you. And so the idea is, well, I don't want this person to get heat stroke. I don't want to get sunburn. So you move them into the shade. But if in the meadow, like in this particular case, it was about 90 degrees, but it was right on almost a 30-degree difference. Well, the person was hot. They were sweaty. They had just went across a granite rock face up in the Trinity Alps. Got injured in the meadow because they had a couple of issues that we're going to get to. And then what happened? The two people working to rescue them laid them down on the cold floor, which just sucked the heat out of their body. And now they have a concussion with hypothermia. And now you got to build a fire because nobody had anything to provide heat to put under their armpits and stuff. And so everything is now starting to build into it. One of the other people ended up passing out because they were very concerned about this individual. And so they were going into shock. And so now you start to get other things that all were preventable had we just looked at our environment. So you got to remember, we talk all the time in hunting about microclimates and the different ecosystems that we go through. Realize those have a medical impact on your patient. And so sometimes you can take advantage of those, and I always recommend doing it, but make sure you're not taking that into consideration always. And that's what I mean by your head's got to be on a swivel. You've got to be looking at everything, and calling on one of the other people with you, as long as you're not the sole rescuer in that situation, to be able to look out and make sure that they're also backing you up on that. Next one's hydration. So I'm going to tell a non-wilderness story to explain this because I think it really points out some issues on hydration. Other big pet peeve of mine. So obviously, if you're thirsty, you're already in a state of dehydration. And I think a lot of us, we discount that because, you get thirsty. Oh, I'll go stop and then insert wherever it is and get something to drink. Often it's not something that's going to satisfy the dehydration issue, because if it's got caffeine and other things in it, it actually makes it worse, but it's what we do. And I want to make sure a couple of things. Thirst often is mistaken for hunger, and it's not. It's just you don't have enough fluid in you. One of the things that you got to realize, your metabolic rate will slow down, but also 80% of people, as I have here, suffering from dehydration have increased back and joint pain. So if those cheap complaints are my joints hurt and stuff, be thinking in your head, when's the last time you drank water? How much did you have? A lot of times what I found was people are like, water? I don't have any more water. I drank my last water 3 hours ago. The other thing is for you as the rescuer, remember, dehydration causes fatigue and decreases your motor skills, your concentration, and your memory retention. And so a lot of times, the Good Samaritan trying to be good hands over all their water to their patient. And now you just created you as the second patient. You have to keep yourself together to keep them together. And so I tell people all the time, make sure you're staying hydrated. Now, I said I'd share the story. Here's the story. In the LA Unified School District, they have classes that are like, you have the same teacher for like third and fourth grade, the same fellow students. So you're actually together with everybody for 2 years. The paramedicine school at the University of Southern California went into a couple of classrooms in the third grade. In these classes, most of the kids were at the CD level. So curriculum doesn't change. Nothing changes except during their fourth grade. Medic students spent time in each of the classes making sure the kids were drinking 3 bottles of water a day. That was the only change. Other than their grades were now A's and B's. So it wasn't the curriculum was bad. It wasn't the teacher was bad. It wasn't the kids were bad. It was they were dehydrated. Simply making sure they were getting enough water improved their ability to learn.
Wow.
And so I say that to people because that's like a really good lab experience because everything else was stable except for water and the difference of what it looked like a year without and a year with adequate hydration.
Wow.
Next is nutrition. So this is so much easier than when I first started out, especially in the military or anything. You have so many options. You're not isolated to one thing. The quality of the food, both in terms of its nutritional value as well as taste, has greatly improved. You can go with things like a thing of flour tortillas and jerky and nuts, but you can also get, the almond butter, lunch to go, energy bars, whatever you may see up there. Make sure you have enough for you and your team. This is another area that people say, yeah, because they don't think they're going to be in the field that long. A great story I have was a gentleman, a very accomplished hunter, had went up into Utah, went up over a small hill where they were trying to get some equipment out of a car. The car axle broke. He didn't know that because when he got on the other side, he saw his elk. He took his shot, went down there. They never came for him. And all of a sudden, he ended up having to hike 12 miles back because they thought he had caught a ride with somebody else. He had no food because he left his backpack in the car. So always make sure you have food and always make sure you have enough food for you and possibly one other person for 24 hours beyond the time you intend to be out there. And that way, if you have multiple people in the party, you will have enough food that if you get stuck for 2 or 3 days, you're going to be okay. But if you don't do that, you're not going to be okay. And if you have to ration it, that's when you do it. But it's not going to be easy to ration food when you're the only one with food and everybody else is looking at you. Like you just don't want to be in that situation. Lack of proper training. And so I have weights. So most people are like, wait, where's he going with this? First and foremost, you yourself have to be physically ready to provide care in the wilderness. And age plays games on us. We write checks with our body that our body's incapable of cashing when it gets in trouble. So I tell people all the time, make sure that you're getting yourself physically fit, physically ready for wherever you're going in the wilderness. I know sometimes we get really unique opportunities to go out into the woods or the desert or, up skiing or whatever it may be that you're going to go do. And it's on short notice. Maybe you just came off of being sick. Maybe you've been locked up for a couple of years. I don't know when that ever happened to any of us, but you end up in those situations, and where you were 2 years ago and where you are that first outing, it's not going to be the same place. But this also goes to just like we should be telling our hunting students and anybody in going into the wild, we are always students. I have done this literally off and on for the past 40 years. It's about 26 years worth of experience combined. I'm still a student. I still go to refresher courses. I still go and sit on different things. I've taken classes across the country to try to learn and update my skills. Things change, ideas change. constantly be doing it. But the moment you think you know it all and you're physically ready for it, Murphy will show up. That's a
Mm.
guarantee. I'm going to have some resources, but if it's okay with you, Lieutenant Elliott, I'll move to the good old Q&A.
Are there other opportunities for continuing education that focus on wilderness emergency medicine?
Yes, I'll put up, we'll still do the Q&A so everybody can see. There's a couple of classes I recommend. The first
Okay,
one I'm going to put up here is called Stop the Bleed.
very good.
I'm an instructor. I talked to Lieutenant Elliott. I'll show you where there's a couple classes up, but also if there's a group of you in an area that want to do this, I can help you do it online. If I'm in the area, because I travel the state in my paying job, I'm more than happy. But this is a wonderful course that I can create instructors with, but I can also create just people with it that will teach you the very first thing of how to stop the major bleed so you can handle the other things. And this is something that is very important for everybody to have. Unfortunately, because of the war, because you just never want to have a war, but this is the other side of it. Wars and major incidents create opportunities for us to learn. And so one of the things that we have gotten very good at in modern medicine, especially wilderness and disaster and battlefield medicine, is stopping the bleed. And so this isn't just about being a tourniquet, it's learning how to pack the wound, how to keep the wound clean, and how to literally stop losing that life precious blood. So I highly recommend that. I put these up. There's other places to go. But at the CRPA, we do offer a couple of Stop the Bleed courses in May. We have an instructor's course in June. And then I am teaching a 2-day, 16-hour wilderness first aid. And then I will be in October be teaching a week-long wilderness first responder course. And so, you know, anything I can do to help any of the people that are on this or watch this in the future, I am more than willing to do.
Love it, Rick. Thank you. Another question came in about misdiagnosis and some things to look for. So let's just talk for someone, just a layperson that has minimal training and they come across uh, an emergency situation.
Right.
How do you know that? How do you know what to diagnose a patient with?
Well, that's a great question. And most of the misdiagnosis, like no one's going to get mad because
Yeah,
you didn't understand the fracture that the person had, you know, or things like that. But and no one's going to get mad, period. So I always tell people that, you know, no one's going to look at you and say, oh, you should have used a 4x4 instead of a 2x2. No, you stop the bleed. You're fine. Don't worry about it. Where the issues can come in is because you didn't do that medical history, you didn't ask questions, and you're looking at the patient and you're hearing what their chief complaint is. I think that's where the
yeah,
majority of misdiagnoses has come. Because think about how many times that in your own life you hurt initially, maybe like after working in the yard all day long, and you're like, oh, my arch and my leg hurts, only to find out, you know, the next morning when you get up, your arch hurt because, well, you pulled something in your lower back, or you did some, there was actually a more important injury, but your body wasn't there yet. You know, that's one of the issues that you got to realize. Some of us have very low pain thresholds, some of us have very pain thresholds. And so I have no problem sharing. Anything gets stuck in my teeth, I'm an absolute 2-year-old baby. But I literally, in one incident, had broke all the ribs on one side of my body. I did that about 1 o'clock in the afternoon and didn't realize it until 2 o'clock in the morning. I
mhm,
continued to function. I shouldn't have been able to. There were some signs, but no one saw them, and I didn't feel any pain, so I wasn't complaining about it. But I was complaining about that I also broke a finger, and that was the big chief complaint was my finger. That was
yeah.
nothing compared to what I actually did. So that's where going back through that, you know, head to toe assessment is so important. So don't allow the patient, unless, like I said, they can't breathe or they're bleeding, don't allow that first chief complaint to be your only focus. That's where misdiagnoses most of the time happen.
Well said, Rick. Thank you. And one thing wanted to bring up, something that we're seeing more in the hunting community, especially with the onslaught of all these extremely sharp knives, whether it's like a Havalon or like a razor sharp knife. I mean, they're just so incredibly sharp. And so what we're seeing in the field is more and more hunters, as they're field dressing or skinning game, especially game that has thick hides, we're seeing slips as they're going up through the hide. And next thing you know, that person has cut themselves. And sometimes these cuts are not just minor, they become
Yeah,
major. And so another reason to know how to handle that, know how to stop that bleed. And also, just what I tell my sons is, let's be prepared for an accident. So even before we are field dressing an animal or skinning an animal, especially with elk with that have thick hides, is to have that medical kit accessible out of the pack, so everybody knows where that is, just in case, because that can turn nasty really fast.
so I think this is really great what you brought up. So if, and I know you and I talked a little bit before you took your kids on this last hunt, but had I been going with you, I would have looked at you and said, okay, so knowing that, let's go get like 2 or 3 sets of Kevlar gloves to
Yeah.
use when we're skiing the animal, because A, they're going to give us more grip strength because animals are wet, especially thick animals like an elk. And the other thing is, if you do slip, the odds of the injury penetrating that glove is really, really low. The
Mhm.
first time. Now, if you keep making those mistakes, the glove will give out. But that's what I mean by there's things that you should be thinking of medically. Where are my injuries? Well, Eric brought up, hey, during that process, we could get injured. Well, is there anything we can bring that's lightweight that could minimize, if not prevent it? Yeah, those gloves.
Right. And I love the idea of you just having multiple items, whether it's multiple first aid kits or even multiple communication devices, and having people actually know how to use them.
Right.
And whether it's a spot device or an in-reach device, something we commonly do is actually, I'll have whoever's going on the hunt actually practice using the in-reach device. Hey, this is
Mhm.
the SOS. Don't hit that right now. But on the other hand, this is how you can send a message and know what that function will do. So
Mhm.
just being just the old Boy Scout motto of being prepared and thinking outside the box, thinking in advance, what could go wrong? Because as you said, Murphy's Law, it's like
Mhm.
you never know what's going to
Yeah.
happen. So, so I think that's about the last of the questions that I have. Actually, there's one more that just came in, and it's asking, if you pack a wound with clotting material and then wrap the wound, would you try to replace the clotting material or
No,
just clean around the wound?
just clean around the outside of the wound.
Very
Yeah,
good.
you never,
Okay.
that's one of the things that you got to realize clotting materials and bandages have certain weaves that are designed to help coagulate and form a seal that at least temporarily on that area. You don't want to reopen that until you're in an advanced medical care situation like an emergency room, because and that's the same thing too. Like if you had one of those knives and got stuck in somebody, you don't want to pull it out. You want to bandage it in place, but that means now you got to be very careful because, like you said, some of those, like a Havalon, are so razor sharp that moving them, that could be an issue very quickly.
Oh, man. Here's a really good question. And don't be afraid to say, don't be afraid to give a pass if you don't know the answer. But are there any legal ramifications for administering care or not administering care? So he's talking about the Good Samaritan law.
Right. So if you choose not to administer care, people are like, well, will I be sued for that? I mean, the biggest thing, and I don't say this to guilt anybody, any of us that have worked as first responders, well, if they're being honest, will tell you that that is part of what adds to what goes in our cup over a career of the woulda, shoulda, coulda. So, if you don't want to have that, then you got to figure it out. But again, if the scene's not safe, then you made the right decision. If you're like, this is above my ability, that's the right decision. However, people are like, well, it isn't my ability, but then the person gets upset because, they couldn't, Like I had somebody that got bit by a rattlesnake and they lost 3 fingers.
Hmm.
That's part of what happens,
Yeah.
but they wanted to sue everybody. They brought the suit. It wasn't fun. It wasn't great. I've been sued a couple of times. Both times I was found that I did nothing wrong, but it's California. I'll just say it that way. You can sue on just about anything. But Good Samaritan laws do protect you. And that is one of the reasons I said, by continuing to go get education, then, you're going to be good. You're going to know what you're doing. And that's also why I said at the very beginning, taking notes, because then, most lawsuits happen about 11 months after the incident. Nobody remembers 11 months later. But if you have those notes, you're good.
Very good. So let's just say you don't have any kind of certification. You just passed hunter education and this is your first hunt and you run across a medical emergency. Do you actually need a certification to
Nope.
work on somebody?
Nope. You don't need
Awesome.
it. Yeah.
So just the basics and even some
Yeah.
common sense.
Yeah. Just basic common sense, like I put 2 sticks because it looked like they broke their leg and I roped it together and had them sit against a tree and went and got help. Good. That's common sense. You were trying to help. That's what the Good Samaritan law is for.
Very good. And then I think we'll take this as our last question is how do you know when to stop with that sample acronym? If someone is not breathing, arterial breathing, other.
Okay, so that's a great question. So this is where I'm going to comment. I mean, if you had 5 medical professionals that worked in emergency rooms, you would probably get 5 variations on the answer. So for me personally, where I have generally stopped is if the patient themselves can't get that information, I try to glean as much of it from the people they're with. I will put a caveat on that, and I'll share this really quickly. I had a rescue up in an area called the Desolation Wilderness. It's above Lake Tahoe, specifically Aloha Lakes. You're very high up in altitude. I had a lady, and for those of you who work with like youth organizations or hiking clubs, etc., a lot of you will have a medical form that you have to fill out. A lot of people, I'm just going to be blunt, they lie. They fake signatures for doctors and stuff because they think they won't be able to go because they might have, diabetes or something like that. She had a definite heart condition that would prevent her from going above 4,000 feet. And at 9,000 feet, her heart started to shut down. She was the sole person for the girls on that trip. And she didn't want the girls to get canceled because she couldn't go. And so she went and she pushed it. And that was a great example of, nobody was prepared for that, but because and the information we had for the sample was not good because she had forged and lied about it. So, but what helped was 2 of the people knew her and were able to say, hey, this person has these issues. And then when I confronted her as the rescuer, then, I was able to, we got down lower in elevation, she was able to talk more as things got better and improved and was able to use that information. So, sometimes you can't get the information, but long as you said, hey, I tried to grab this information, that shows where your head was in the game, and that's important.
I love it. Rick, I just want to take a second to personally thank you so much for your willingness to come on tonight. And thanks for volunteering your time as a hunter education instructor as well.
My pleasure.
All right, brother. Thank you so much. We'll
Thank
talk
you.
later. All
Okay.
right.
Bye-bye.